Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're an adult, you probably remember being a preteen or teenager, having that dreaded moment where you wake up in the morning, look in the mirror, and see a big red dot that appeared to have grown overnight on your face. Pimples and zits are no fun, and most everyone will have dealt with acne at least once in their lifetime. Express Care's Dr. Jitka Lom joins us now with some tips on how to banish those blemishes and clear the air on what works for acne and what doesn't. Thanks, Doc, for coming in. So what exactly is acne and what causes it?
Okay, well, acne is an inflammatory condition of the skin. Like you said, it tends to affect teenagers for sure, but there is adult acne. And what causes it? We have four main factors. One is heredity. Of course, if things are in your family, you'll be more prone to acne. Then hormones, women before their period, and teenagers, of course, as they're in puberty. Their testosterone levels in their skin will be a little higher, and that will fuel the next factor, which is oil. So if you have very oily skin, you will tend to have acne. And that's because bacteria, there's a particular bacteria called Propionibacter acnes, and that one is on your skin anyway, but if there's a lot of oil, it will have the opportunity to proliferate. And at that point, you will get basically a bacterial infection. So we have bacteria, oil, hormones, and heredity that are causing your acne.
Okay, so can certain environmental factors cause breakouts or even certain foods?
Sure, they can, especially for some people. Everybody's a little different, but changing climate, especially hot, humid climate, can produce more oil for you on your skin.
Especially on Guam.
Especially on Guam, yeah. Sweating a lot. And then as far as foods, everybody's different, and certain people are very sensitive to milk and dairy products, and others to sugar. So if there's something you want to do, knock out your sugar and your milk and drink lots of water instead, and see if that helps your skin.
I've never heard milk.
Mm-hmm.
Okay, so why is it that teens seem to go through an acne phase? Women, you said, while we're going through our menstrual cycles, is it just because of all the hormones in our body?
Mm-hmm. In a woman's menstrual cycle, there's a fluctuation, and right before our period, we have a high level of testosterone more in our skin, in a relative imbalance. And same for teenagers, so that's why the young boys, when they hit 14, 15, will start to have a lot of acne, and young girls as well.
So what do you suggest for the young teens out there that suddenly have these big breakouts of acne and are trying all these different cleansers and things like that?
And that's a key point. They are trying many different things, and sometimes that can also aggravate. Using different products can aggravate your skin. Over-cleansing can aggravate. But proper hygiene is really important, and so just like you have to remind your teenagers to brush their teeth, you do have to tell them to wash their face with warm water a couple times a day using a mild cleanser, something like Dove soap or even Ivory or Cetaphil. These are fine, or Neutrogena. These are good products. Just a little bit, and washing your face twice a day is a really excellent start to managing your acne, and not switching products. Then there are so many different products to help you, focusing on reducing your oil and removing your bacteria. So one of the ones that we see a lot over the counter is benzoyl peroxide. That's a great start for most people. It's over the counter. There's different names, Clearasil, Clean and Clear. These are all with benzoyl peroxide. And if you use a low percentage, 2.5% or 5%, which you can get over the counter, but you apply it liberally, meaning you apply a lot on your face once or twice a day, that will help many people.
Okay. Now, what's the difference between a blemish, a blackhead, or a pimple? There's so many names out there.
Yeah, there's a lot of names. So, so if you take a pore that's clean and you plug it up way deep down under the skin, that's a whitehead. It's just a pore that has filled with what's called sebum. That's the oil, and it'll just be like a little white bump. Then as that progresses, as that oil makes its way up to the surface and breaks the surface, and the actual sebum oxidizes when it's exposed to oxygen, that tip of it will turn black, and that's called a blackhead. And that's what we call non-inflammatory acne, whiteheads and blackheads. Then, if there's a lot of bacteria and a lot of inflammation, those pores can get really infected and red and inflamed. And then you get what's called a papule or a pustule, meaning the yellow, the red thing with the little yellow pus thing on top. Those are called papules and pustules. So, and you can even have cysts, which are really big, giant, painful ones way down under the surface of the skin. So it can get very nasty.
So how do you get rid of them?
Well, with oral medication, because at that point we really have to destroy the bacteria. So we take antibiotics. There are even more powerful medications to destroy the oil glands called Accutane. Very, very powerful. And we can inject them with steroid medicine.
So don't pop them.
Do not pop them. Now you understand, okay, there's oil there, there's bacteria there. By popping it, you're fueling the inflammation and you're spreading the germ.
Okay. Now, what is the fastest way to get rid of a pimple? You know, a lot of people think popping it is the way to go, but like you were saying, it could actually make things worse.
Try not to. Try not to. If you can cover it up and give it time to heal on its own, it's best. You can apply a drying agent. So something like the benzoyl peroxide in a paste, you can buy that as a gel or a cream. You can apply that thick on your pimple overnight and it will shrink it a little bit. We can also inject them in the clinic. You just put a tiny needle right into the pimple and it'll shrink pretty much overnight.
And so what do you suggest for people out there? You know, what should you do a daily regimen? Like I've talked to some people and they say, oh, my daughter uses a cleanser and it doesn't work, so then she changes it. So her face is constantly trying to get used to the new cleanser. So how long do you suggest somebody have this regimen?
Try something for at least 6 weeks before you throw it away and say it's not working. And know that with certain products, your body will respond initially and then stop responding. So you just really have to give it time. But products like Cetaphil, a Neutrogena, even Oil of Olay, these are very good and will work for most people. You do not have to spend a lot of money at DFS doing that. Yeah, really don't.
Okay, good to know. We have to break away, but stay with us. We will pick up our discussion on acne when Healthy Living continues. Stay with us.